Okay, hi guys, it's Sandra here from battlewithbipolar.tumblr.com. I was going to do a video in regards to my experience with bipolar disorder, anxiety, depression, psychosis, mania, all of that. I was supposed to do it a while ago, but I've had a lot going on in my life lately. I've recently come back from overseas because I'm from Poland, so my cousin got married over there last month. And unfortunately, I spent the last probably 3 weeks of July in a psychiatric ward again. So I won't go into that on the first video. First off, I'll just talk about how I got diagnosed with bipolar, what I sort of did to get diagnosed, the symptoms I had, and what I was doing. Now, I can't really tell you exactly how or why it began. Now, bipolar, normally the onset of it comes, you know, when someone's in their, I don't know, age 17 and up. Usually sometimes even in their, you know, early 20s or mid-20s. So anyway, it was 2004. I was 14. I was a really good student at school. Always got good grades, had a lot of friends, everything like that. I was a bit of a shy kid, but, you know, I kind of got over that. Like, once I get to know someone, I did quite talk a lot. Anyway, so, I remember, I guess you could say I started to develop psychosis. Obviously I didn't know at the time, but, I'll just tell you what I was doing and how I was acting, because, like I said, I have no idea why or how it started. So one day, I just started acting really weird at school, and by weird I mean like I was like socially isolating myself, like I never had anything to talk about with anyone, like all my friends were just, you know, I couldn't talk to them, like I didn't know what to say, I couldn't laugh, I was really upset all the time, and the best way to describe it was I became dumb. Like, my mind became dumb. I just felt stupid. Like, I couldn't read properly, I couldn't write. Like, you know, English always used to be my best subject, and I couldn't even write a short story. I mean, like, I could write, but when I read it back, it didn't make sense. It was like all this, I don't know, all this weird stuff, like, to do with, I don't know, like God and grandeur, like thinking I'm some higher power, or there's, you know, somehow higher power that's trying to talk to me, that I'm some chosen one. Like, it was just really bizarre. But I remember that happened because one of my friends at the time in class gave me a book to read, and I still remember that book to this day. It was called The Divine Revelation of Hell by Mary K. Baxter. It was basically a book about, you know, a woman who got a tour of hell, you know, by Jesus or whatever. So I read that, and it was freaky. Like, it was a really intense book. Like, I remember I cried quite a lot during it, and I couldn't read it. I had to wait, you know, like a day or two before I read another chapter and things like that, because it was quite overwhelming. Anyway, so I read it, and then I started acting funny. Like, I remember one night I just thought for some reason that there was, you know, I would look out my window at night and I thought there was crosses in the sky, and like I just thought these stars would just develop into crosses. I was like, okay, what's going on? Anyway, so I rang my dad, and it was like 1 o'clock in the morning, and I was ringing him, and I told him what I was seeing, what I was feeling, and he was just like really worried about me. He thought there was something wrong. In that same night, now I don't know if this really happened or if this is just my imagination, I guess this could be classified as psychosis. I went into my mum's room. All the clocks had stopped that she had in the bedroom, and I remember holding my mum's hands, and we started looking into each other's eyes, and we were praying in Polish. Like, we were doing like a prayer, and, you know, and then we were holding our hands, and our prayers were getting louder and louder and louder. And then I remember, I looked at my mum, and I became really scared because her face, like, resembled, like, a devil. And then I let go all of a sudden, and I just screamed, and I just ran out of the room. So that was probably the first thing. Second thing was, after school, every time I'd be at home, I would just look through my drawers. Like, I would open them, close them, open them, close them. My parents were like, what are you looking for? I'm like, I don't, like, I knew at the time what I was looking for, but I can't remember now, obviously. And yeah, it was really strange. And then I don't really remember much, but all I remember was one day, before going to school, I didn't want to go to school. All my friends were like thinking I was some sort of a freak because I was acting really weird. I basically had no friends at lunchtime. Like, I had to sit by myself, and it was just horrible. And that obviously made me spiral into depression. So all these sort of weird hallucinations I was having with seeing crosses in the sky and thinking I was some chosen one or something like that, or that some higher power was like talking to me, I ended up getting sent to hospital. So my mum called a psychologist. I don't know what she told them, probably just the way I was acting. And one morning I thought I was going to school. Next thing you know, not going to school. An ambulance had pulled up, and some paramedics got out, and they dragged me, essentially kicking and screaming. They took them about 15 to 20 minutes to drag me out the door, because I was standing there in the doorway, like blocking the door, and they took me to like a mental health clinic thing, and I had an assessment there by a psychiatrist. I can't really remember much from it, because obviously now I know that I was obviously having an episode at the time, and I went to hospital. It was a children's psychiatric ward, and I was in there for nearly 2 months. And the reason I was in there for such a long time was because they couldn't diagnose me with anything for like the first month. So I was getting fed like literally 10 different types of pills, medications every single day, and I had no idea what they were for. I remember one little girl, she was probably about 8 years old, because I was 14 at the time, so I was one of the older ones in there, and she, you know, they handed me like my cup of pills, and they were just like, and she's just like, what are you going to take all those pills for? Are you crazy or something? And that just set me off. Like, I got so upset, I cried, I didn't want to come out of my room, the nurses couldn't get me out. I was very homesick as well, because I'm the kind of person that when I was younger I could not be away from my parents for like a night without like crying or getting upset. Like, I couldn't even do a school camp without like getting really upset every night if I couldn't see my parents. So it was hard, you know, because you're in this environment and you don't know, you know, what sort of people you're going to meet. I remember they put me in a room by myself, sort of around the back of the ward first, and then for some reason the next day they moved me like right up the front, and I had to share a room with this girl who had anorexia. She was really, really nice. I think she was a little bit older than me, she was probably a year or two older. So one thing that I did when I was in hospital, and this was part of the depression, because obviously they said I was depressed, and they said I had symptoms of psychosis. There was no mania present in this episode. I remember they had to call in some sort of psychiatrist from a different state, and it came up with that diagnosis of bipolar type 1. So there is a difference. There's bipolar type 1, there's type 2, there's a rapid cycling form, there's a seasonal one. Like, rapid cycling is when your moods change really quick. Or obviously type 1 is mine, where you have an episode that can be a depressive episode, that can be a manic episode, hypomanic. Usually hypomania is part of bipolar type 2. So bipolar type 1 is pretty bad, because, you know, when you have mania, you have full-blown mania. And I'll talk about mania in another one of my videos, because I just want to focus on my first episode and my diagnosis first. So yeah, so he diagnosed me with that, and my parents were just like, what is that? You know, because no one in the family has a mental illness. Maybe people did have susceptibilities, well, you know, to a mental illness, but they didn't actually, no one's been formally diagnosed with anything in my family. So, you know, the psychiatrist explained what it was, obviously with the mood that had gone down, and then obviously he said that it was psychosis, because, you know, I was thinking that there was people talking to me, that there was someone out to get me. I remember I kept saying all the time to my parents, oh, I'm guilty, I've done something wrong, and they'd say, what have you done? And I said, I don't, you know, like, I just didn't know. I think the depression part stemmed from there was a lot of bad stuff going on between my parents. And I probably shouldn't say this, but I don't really think my parents would ever watch this, but my mum had started gambling a lot, like on the pokies and stuff, and I mean a lot, I won't go into details, but it was a lot, like it was a big amount. She started, and this is what started the fights at home with my parents, like they would always fight over money, and I guess that's what caused me to have the breakdown, because there was talk of them getting a divorce, and you know, I was the only child, I didn't have anyone for support, anyone to lean on, anyone to talk to, so the prospect of my parents getting divorced just freaked me out, like it just made me so upset. Anyway, so in hospital, after the diagnosis, it took them a while to fine-tune the medication, to find the right medication, because the worst part about bipolar is it's different for everyone. Like, you might have another person that's also got, say, type 1 like me, but everyone's different, everyone has different types of episodes, different variations of the episodes, and like one of my things was, like, because it was obviously I was depressed, I couldn't make up my mind. I was very indecisive. So what I'd do in the morning when they'd wake me up at hospital was I'd pull out a t-shirt to put on, and then I'd get out like a pair of jeans, and then I'd be like, no, I don't want to wear these jeans, so I'd put them back, and they'd take out a skirt, and then I'd be like, oh, hang on, I don't want to wear that top, you know, and I just couldn't make up my mind. So I was trying to get dressed for half an hour, and I couldn't decide. So one time a nurse just came in, she just grabbed whatever, like she just grabbed a shirt and you know, like a pair of pants, and she's like, put this on. So I actually found myself walking around the ward and in the hospital school wearing mismatched clothes, which was rather embarrassing, and everyone was looking at me like I was a complete freak. I had to go to hospital school there, and it was the worst experience ever, because obviously I didn't know anyone, I didn't make friends with anyone, because when you're depressed, you're not yourself. You stop talking. Like, I just stopped talking. I was like a mute. I just didn't say anything. You know, you'd watch something really funny, like a funny movie, or people would tell jokes and whatever, and you would just sit there like a zombie. Like, I had no... I don't know, I was just lifeless. That's the best way to describe it. Like, I was alive. I was walking around, but inside I was like dead. And I couldn't make any friends, and people were just looking at me like I was a freak, but maybe that was also part of it. I had a bit of paranoia, because I thought everyone hated me, and you know, it just made it really hard to make friends at the school. And I still had that thing going where I couldn't construct coherent sentences. Like, I'd still just, okay, the best way to explain it was, my mind became like the mind of a preschooler. Like, it was hard, like I said, to be decisive, to choose what to wear during the day. I couldn't do that without assistance from the nurses, you know. I just became dumb. That's the best way to describe it. You know, I didn't know what assignments to do in the hospital school. I just, yeah, it was horrible. And I didn't think it'd ever get better, because it was a long 2 months I was in there. Not really many of my friends knew where I was. Obviously, I didn't want anyone to know that I was in a psych ward, because, you know, people think that, oh, a psych ward, it's where all the loonies are, it's a crazy place, you know, it's a mental institution, you know, there's psychos in there. And contrary to popular belief, it's actually not like that. I didn't make any friends in there, well, besides my roommate, but we didn't really talk that much. But I didn't really make friends in there, because, like I said, when you're depressed, you don't want to talk to anyone, you've got nothing to talk about. Half the time I was on, you know, I was so out of it, because I was so sedated. The medication I was on just knocked me out. Like, I was on really high doses. I was on Seroquel, which is an antipsychotic, which helped obviously with the psychotic symptoms I was having. Then I was on Epilim, I was on lithium, I was on this thing called risperidone, but apparently that made my muscles stiff, so they stopped giving that one to me. I can't even tell you what the rest of the medications I was on, what they were, because I don't know. There were so many of them, and I wasn't really interested at the time anyway. So finally, yeah, after 2 months they let me out, but as you can imagine, the transition from psych ward back to high school, it wasn't good. They were actually thinking about putting me in the special education unit, which was ridiculous, but I thought, well, maybe it'd be easier you know, to transition back to school with getting that extra support from teachers and things like that, you know, to be integrated back into the normal, like with the normal students. But they said, you know, they said, Sandra, you don't need to be in there, like, you're just really depressed, you just need to keep taking your medication and you'll be back to normal. I wasn't back to normal. I was still really depressed. What made it worse was I'd lost all my friends pretty much. So I remember my mum dropped me off at school one day when I was ready to go back. This was grade 9, so it was quite an important year. And I went up to my friends and they looked at me, they whispered to each other, and they turned their backs and they walked away. And this was all the friends that I'd had, you know, since like, some of them since I was like 10 years old, you know, since like grade 5. And they walked away. There was one that said to me, she came over and she just said, just letting you know there's been rumours at school about you, that you have been on drugs, or that you've been in a mental institution, that you're in a mental ward, and that you're like a psycho. And I was just like, wow, gee, thanks for telling me that, you know, and I just cried and I didn't know what to do. So that year kind of, because I was in the hospital in May 2004, so it stuffed up pretty much my whole year. But towards the end of the year, I gained some of those friends back when I started being myself more, when the depression sort of started going away. But one thing that I made, it was a very big mistake, and I think it's really important for anyone who is experiencing, whether it be bipolar, depression, anxiety, mania, hypomania, psychosis, whatever you have, you need to take medication. And I know a lot of people don't want to do that, because hey, I'm the poster girl for not wanting to take your medication, because I went off my meds probably around August that year, so about 4 or 5 months later. Obviously coming straight out of hospital, I was under what's called an involuntary treatment order, which means you have to take your medication, you have to go see a psychologist like every week. I never had much to say in those meetings. Like, me and Dad used to go and I would just sit there and I just like wasn't in the mood, because, you know, because they do this thing called CBT, cognitive behavioural therapy, like teaching you how to change your thoughts and how to be more positive. And it just, when you're depressed, you don't want to hear it, you know, you don't want a bar of it. And so I went off my meds after I was released from the ITO, from the involuntary treatment order. And obviously I was still pretending to take my meds in front of my parents, but I would hide them. Like, I would spit them out, I'd put them in the bin, or I'd hide them under my bed, or under, you know, like my rug, or just in random places, like in my desk drawers and things like that. And then one time my mum was changing like my bin and she saw some pills in there, so she was like, okay, you're not taking your medication. They couldn't really do much about it, because they're just like, I remember Dad saying, you know what, if you don't want to take your meds, that's your choice, because apparently the doctor said that I would have another episode if I went off my medication. But, you know, me being me, I was like, no, there's nothing wrong with me. I had this notion at the time, I was like, I don't want to pollute my body with drugs, or pharmaceutical drugs, and I didn't know that, you know, that was gonna be a bad thing. I'll tell you what happened next in my next video. So yeah, so having that episode, it changed my life, because all of a sudden, you know, you're 14, you're a teenager, you have so much to deal with. You know, adolescence is a really turbulent time, and then, you know, you have this disorder, this mental illness, you know, and then you have people that don't understand, you know, there's a stigma attached to it. You know, I got called everything, you know, psycho, or drug screwed up in the head, I won't even say the word. There was just so many insults flying left, right and centre. I felt ashamed in front of my parents. I felt like I was lesser of a person. I felt worthless. And another thing, I get a lot of questions in my ask box on my Tumblr from my followers. It really has exposed me and to the fact that there are so many people, like teenagers especially, because most of you that write to me are pretty young, you know, you're like, because I'm 23, so I'm a bit older, but I'm, you 16, 17, you know, you're really young, and you know, you're telling, some of you tell me that, you know, you're too ashamed to tell your parents you think you've got depression, or, you know, you ask what are the symptoms of bipolar, or, you know, I've had some people anonymously, you know, tell me that they feel like, you know, ending their lives, you know, like killing themselves and stuff like that, and I can tell you I've been there. I've had the suicidal thoughts, I've had the suicidal ideation, I've had a plan, I've had all of it. I never followed through with any of it though. One thing also I know is a big thing on Tumblr is people posting photos of, you know, themselves, they're cutting themselves or slitting their wrists and other parts of their bodies, and I don't think it should be glorified in any way. No, I don't think it's attention seeking. I just think that for some people, yeah, it could be a cry for help, but a lot of people, it could be just a release, but it's the wrong kind of release. So I'll just tell you guys what I used to do, and I know this sounds really, really, really stupid, but when I thought about, or maybe I'll cut myself, you know, when I thought about it, when I was really depressed, I would just go to my bathroom, I'd grab a red pen, and I'd sit down, I'd lock the door, and I would just sit there, and I would cry. So first I'd let it all out, and I remember I would just stare at my wrists for, I don't know, for like 10-15 minutes, thinking, should I do it, should I try it? But I was always too scared to. So what I did was, I got the red pen, and I just drew lines, like, just all over my wrists, just all over. And for some reason that helped me. I know that must sound really odd, but I did put up a post a few weeks ago, probably about a month ago now, to some of my followers, that some of my followers probably would have read about that, and just drawing the red lines. So basically, I want to finish this video off here at the moment, because I don't want to ramble on and on and on about my illness in one video, and all about my episodes in one. So I want you guys, if you do get this far and if you do watch the end of it, congratulations, you're listening to the rambling person. That's really good. I want you guys to inbox me your questions. I want you to ask me stuff, and I'll answer, or, you know, comment or whatever. So yeah, just ask me anything you want to know, or anything you want to know about me, or anything you want to, any questions you want me to answer about bipolar or anxiety or depression or psychosis or mania or hypomania. So please feel free to do it. Don't be embarrassed, don't be ashamed, and if you do need someone to talk to, you know, you guys know where I am, you know where my ask box is. So yeah, I'll talk to you guys soon, and thanks for listening.